Hi, my name is Justin Cohen. I'm a urologist at UroPartners. Prostate cancer is the most common cancer in men. Almost 250,000 men in the United States each year get diagnosed with prostate cancer. Luckily, many cases of prostate cancer are either able to be followed without actively treating it or able to be very easily cured. Only about 15% of those who get diagnosed with prostate cancer will ever die from it. It's usually more than 10 years in the future. So there are three main treatment options for prostate cancer. The first, for very low and low-risk disease, is active surveillance, where we carefully monitor the cancer to make sure that it doesn't get worse. And with that, we can help most of those men avoid any side effects of treatment with radiation or surgery, such as incontinence and erectile dysfunction. There are two types of radiation that we typically use for prostate cancer. One is brachytherapy, where we insert radioactive seeds into the prostate that helps kill the cancer cells. And the other is external beam radiation therapy, where we use invisible X-ray beams to radiate the prostate and kill the cancer cells. The last treatment option for prostate cancer is surgical, and that's called a radical prostatectomy. We do those either with an open incision or multiple small incisions using the assistance of the Da Vinci surgical robot. For the robotic surgery, we place the patient under anesthesia and then introduce multiple small incisions through which we can put the robotic ports. Once we get into the abdomen, we carefully free up the prostate gland and the surrounding tissues. We remove the seminal vesicles along with the prostate. For most men, we attempt to spare the nerves that lead to erection, which drape right over the top part of the prostate. We do this very carefully to help preserve as much sexual function as possible without leaving any prostate tissue behind. We then sever the prostate where it attaches to both the bladder and the urethra, and we remove the prostate gland. We then have to hook the bladder back up to the urethra and do this very carefully to help preserve continence. In some cases, we remove the lymph nodes that drain the prostate to help stage the patient and make sure that the cancer hasn't spread locally to those lymph nodes.